Hello, good afternoon. 안녕하세요. Just want to begin by thanking Venerable Hisu Sunim and all the organizers to allow me to have this opportunity to share a little bit with you about acceptance and commitment therapy. I feel very honored and humbled to have this chance to share just a little bit about what I understand about ACT, and I hope that it will be helpful to spur on discussions. And so I'm really honored to be here so that we can have the dialogue about what can be helpful for healing. So it's going to be about acceptance commitment therapy. Beginning with this slide, I'd like to share some observations which is just the founder of ACT had observed. In that, in Western philosophy, there is an assumption that to be normal is to be healthy, and to be healthy is to be normal. And that usually one should be healthy and not have disease. So one sees disease, it's not normal. It's not normal to suffer. That's the Western philosophical foundation concept that we often assume. And I'm a Western trained psychiatrist, so this is also the perspective that we are trained in. So to treat illness then, philosophically, we would break things down into little parts, just like a car broken down, want to find what's wrong with the car. Is it a part of the engine, right? So this is the way Western science has proceeded. We try to identify what's wrong and fix the broken part. And so the same would be applied to psychology, which is the study of, I guess, the human mind in Western discipline. And in terms of psychological interventions, this was one way to classify psychological interventions. It's not the only way, it's one way that behavioralism or behavioralists would see how we can classify different kinds of psychological interventions like psychotherapy. So from this particular perspective, the origins of Western type of psychotherapy is psychodynamic psychotherapy, like Sigmund Freud, right? So that's the ground zero. And talking about the unconscious mind. This is how Western science begins to do psychological interventions. And then there were some psychologists who were not satisfied with this explanation. And so there was the first wave of therapy called behavioral therapy, looking at behaviors. They're saying, okay, we talk about the unconscious mind, but we cannot see the unconscious mind. How can we be more scientific? So the behavioral therapy looks at actions and behavior. Wow, we can see it. We can do experiments. We can be more scientific. So the behavioralists welcome the behavioral therapy. And to this day, it is used a lot in educational setting. How to help people learn, overcome learning challenges, right? So it's still very popular. And parents do it all the time. You reinforce or you punish, right? Those basic principles. But we find that for human beings, even though they come to a psychologist, you can praise them and you can punish them, but they still can be suffering. So some psychologists say we are human beings. We're smarter than animals, right? So you cannot just use behavioral therapy. We have to think about how people think. So the cognitive therapy comes in. So this is what we call the second wave of psychological intervention, is to look at people's cognition or thinking, CT, cognitive therapy, the thoughts. What kind of thoughts are you having? Are you having positive thoughts or rational thoughts, or are you having distorted thoughts? So the idea for cognitive therapy is to help people who have distorted thoughts to become logical. So logic is seen as to be the most important thing, right? It comes from Socrates, Western philosophy, Socrates, right? So we use Socratic questioning as a way of getting at what's the truth, rational truth. Now, CT and BT were two schools, they fight. Who's right, CT or BT? And then a lot of the research, they just combine the two. So these days, the second wave, you can see, we often call CBT, right? Cognitive behavioral therapy. We have to look at why people are thinking. If they're irrational, we change it to more rational, and we use behavioral principles. And then, here comes like the third wave approach. What is found in psychology is that there are lots of conditions that even though you try to be reasonable, it still doesn't work. They still suffer, right? So that's why there's the acceptance commitment therapy, which we call ACT, which we'll talk about today, dialectical behavioral therapy called DBT for people who have borderline personality disorder and they harm themselves, and mindfulness-based cognitive therapy. It's designed for people with recurrent chronic depression. These three are completely independent therapies, but they have a lot in common in emphasizing acceptance and mindfulness. That's why collectively, sometimes they're also called third wave psychotherapy. And there's something then in common about these. Now, I just want to make a point that ACT itself, it's founded on a philosophical foundation which tries to be different from the original common Western philosophy. So this kind of philosophy is called functional contextualism. So Stephen Hayes, who's the top left-hand corner, who invented ACT, one of the founders of ACT, first wrote a paper on functional contextualism, philosophically about why it's different. Another name for functional contextualism is actually radical behavioralism, because Stephen Hayes comes from the lineage of B.F. Skinner, who is a behavioralist, like the father of behavioralism. And they are also founded on and influenced by American pragmatism, the school of philosophy. William James and John Dewey are often cited, for example, right? So there's this lineage. And this is why there's this question, does ACT come from Buddhism? And some of the answers is no, it comes from American philosophy, American pragmatism, right? Or the work of B.F. Skinner. But actually what we know is that all of these people, even William James and John Dewey, were actually highly influenced by D.T. Suzuki, the Zen master from Japan who went to US. So even though sometimes they ask, does ACT come from Buddhism? They would say, no, it's come from US, America. But if we trace back, we find that they are actually learning a lot from Zen Buddhism from Japan, right? So I'm a cultural psychiatrist, and so I'm interested in the cultural origins of this, and I'm also in the social justice field. And there is a sentiment that oftentimes for Westerners, they don't like to acknowledge like Asian roots and Asian wisdom. So I'm in Canada, I'm a minority there, and I hope that more people would know that Western forms of intervention like ACT, I think has a lot of Asian origins, even though they may say, oh, we invented it in USA, but I don't think so. So the foundation of ACT then comes from radical behavioralism, of functional contextualism. The important thing to know is that it wants to distinguish itself by calling it functional rather than structural, meaning that instead of fixing a broken part, it's how the parts work together rather than something is wrong. And contextualism means everything needs to be taken in context. When we see an action in isolation, we have to understand then the larger context, what determines what's arising, so that we can understand truly why the action is taking place. That's the foundation of behavioralism, which is why you can see that this is already very much in line with American pragmatism, but also Buddhist philosophy about the importance of context and pragmatism. On top of that is the relational frame theory. So from a scientific point of view, they want to invent a theory to understand the human mind. How does it work? Because in cognitive therapy, there's ideas about what philosophically we call mentalism, that, somehow there are these thoughts in our minds, and it will influence emotions, it will influence actions. So I'm a CBT teacher also at the university, so I teach this all the time. Thoughts will lead to behavior, will lead to emotions. But not so from a behavioralist point of view, because philosophically, they argue that this is a mentalism assumption. So relational frame theory, it's designed to correct that. And on top of that is where ACT comes from, a form of psychotherapy. So this is the basic of relational frame theory. If we see a picture over there, right? If we see a picture on the lower right-hand corner, we'll ask, what do you call it? And they would say, a cat. Kuyani or something, is that, right? A cat. And then if we write the word C-A-T, and then the teacher, right? And then people would know, that's cat, right? If you teach that to a child, they would automatically do this in their mind, right? They will automatically make this relationship. This is the foundation of the relational frame theory. It's the theory about how this is called the equivalent class. We learn, this is same as this, it's the same as this, right? So the idea is that these two on the bottom, they don't need to be together in the same room. Even in the same room, they may not be coexistent, but we make the connection in our mind, right? And so this is the beginning how we learn to think in symbols. Although when I say that, I'm borrowing mentalism terms, because behavioralists would not say that. From a behavioral point of view, it's through exemplar training. You train over and over again so that you are responding to the stimulus in a very similar way, as if these are the same thing. But the implications for psychotherapists and psychiatrists and counselors is that, wow, this is how we learn to think. And this is also how we suffer. So this is why ACT wants to say that in other therapies like CBT, suffering is like wrong. You are being irrational. But from an ACT point of view, when you suffer, that's being human. That's because we are learning to think. And this is the origins of suffering, is that we are making all these relationships. This is an equivalent class relationship, but there are also, I need to speak faster. There are also many kinds of relationship. Like A is different from B, is different from C, or A is better than B, better than C. And they cause even more suffering, a lot of relationships. Like, this person is smarter than me. That person is more lucky than me. This person is more beautiful than me. We make all these relationships, and they become real, and we become sad or anxious and worried. Things that has not happened yet. So all these come from connections in the human mind. So ACT is also known as a mindfulness-based psychotherapy, and mindfulness in psychology was kind of started by Jon Kabat-Zinn. And again, Jon Kabat-Zinn, even though he doesn't, sometimes I think it's well known, he actually learned from Buddhist philosophers and Buddhist Zen masters, basically. So he's influenced by 2 or 3 Zen masters, including Thich Nhat Hanh, and also another Korean Zen master, Song San. So Jon Kabat-Zinn, again, he in the US didn't really invent this, but he's learned from the Zen master, and he teaches in psychology that mindfulness is about contact with this present moment, paying attention and become more aware and not automatic pilot. and having an acceptance stance, non-judgmental stance of the present moment. So this is the mindfulness that's taught in all different psychotherapies. All the third wave, like DBT or MBCT or ACT, teaches this as a way to help people become more in the present in a non-judgmental way. Because when we're non-judgmental, we are letting go of all those connections that we form in our minds, right? So this is the ACT core processes that I will go over. So on the lower left-hand corner is cognitive diffusion. The idea is that in our minds, we have made all those connections, and cognitive diffusion is to separate them. Because normally, the thoughts become sticky, like we get bothered by thoughts. And the thoughts is also seems in our mind the same as reality. So we are stuck with our thought, and the thought is stuck with our reality. So we feel, oh, how come reality is so hard, right? But we don't see that a lot of the suffering is the mind. So here is to separate everything out. We see the thought and know that the thought is not the same as reality. Everything is being separated. All the connections that you saw previously, we try in ACT to help people separate them. So that's cognitive diffusion, which is different from CBT. Because CBT, we try to change your thought. We try to convince you to be more rational. So rather than changing thoughts, it's about having a different relationship with your thoughts, which is more diffused or separated. On the upper left-hand corner is acceptance. This is where some of the name comes from. But what do we mean by acceptance here? Acceptance in ACT is described as not avoiding. It's not avoiding. Because when we feel sad, we feel anxious, we want to push it away. We want to make ourselves happier. We don't like to feel sad or anger. We push it away. Or we try to change it by arguing with it. But when we argue with it, we become more entangled because it's a struggle. We say, no, I'm beautiful. Oh, but I'm not beautiful. Yes, I'm beautiful. No, I'm not that beautiful. Yes, I'm beautiful. So it goes in our minds, right? So rather than try to struggle with the thoughts, we accept or allow our thoughts to be there, right? Or rather than pretending I don't have thoughts, pretending I'm okay, pretending I'm not sad, just acknowledge, okay, it's there. So it is allowing thoughts to be there in a non-struggling way. So that's the willingness to experience. On the top is contact with the present moment. So rather than be trapped psychologically in the past, or, oh, in the future I worry, it's, oh, I'm right here in this moment. And on the bottom is self as context. It's about knowing that even though we come and we have a lot of ideas about ourselves, I'm a smart person, no, I'm not so smart, or I'm outgoing person, oh no, I'm like a shy person, oh, I'm a successful person. So a lot of labels. So self as context to say that you are not these labels or stories about ourselves. Just like the cat, right? If we free ourselves from those stories, we see that we are the context and not the content, right? The stories. On the upper right-hand corner, it's values. It's about looking deep inside. What do we really care about? What is a good life, right? If it's not happiness, then what is it, right? If it's not trying to be the richest or something, then what do we really care about? So rather than, let's say in other therapies, we talk about therapeutic goals, we talk about what do you really care about, our values, right? How do you be the caring person you want to be, right? So those are your values. And knowing your values, then we come to action. Because it's one thing to say, I care about something, but how do you look at it through action? So that's the committed action piece, right? So committed action means are you acting that's in alignment with your values? So if you say, oh, I care, I want to take care of myself, right? Are you eating the food? Are you actually exercising? Oh, but I don't have time for exercise. I'm too busy, right? So we look at that and say, how do you commit with your actions? And even though your mind says, I'm too busy, how do you let go of that thought? And how do you actually exercise, right? That's like an example. So if you do all of this, the idea is to have the center, which is not about right or wrong, it's about being flexible. So in ACT, we talk about workability and flexibility, is to be psychologically flexible, right? Do you remember I said that in other psychotherapies, it's more like what is broken. In ACT, we're not trying to find what's broken. It's about how do you function better in different situations, different contexts, and in a way that really said, okay, I believe in something and I'm doing it. So your action is alignment with your values, rather than being stuck in your mind, in the emotions, right? So that's what ACT is. And so it's not coincidental then, because it's influenced by Buddhist philosophy, that, as we said, from the Four Noble Truths, it's very aligned with the idea that life is about suffering, and that when we get too attached, it's kind of what is keeping us in a suffering cycle. So in this point, that lots of people start to notice that it has a lot of correspondence with Buddhism, at least the Buddhist philosophy, compared to, let's say, CBT or other therapies. And the Eightfold Path as well, if we look at the different clusters, without going over point by point, but there is also correspondence between Eightfold Path and the ACT. So you can see, for example, the ethical conduct. These are, the right speech, action, and livelihood. In a way, it corresponds to ACT talking about values. It's not exactly, because ACT is a non-denominational kind of psychotherapy, but you can see ACT talks about values in a way that kind of maps onto that, right? In terms of the right view, we can say there's some parts of it that aligns. And if we look at the unwholesome mental factors, again, there can be some correspondence. In other words, some of the ACT processes may further some of the unwholesome mental factors that is identified in Buddhism. I would point out that there's something like pride. It's more explicitly stated in Buddhism, but it's not perhaps very easily observable in ACT, which culturally it makes sense. There are cultural studies that look at the idea of pride, because in North American psychology, pride is good. It's good to be proud. But in Asian philosophy, like we try to overcome pride. Pride is an obstacle. So culturally, there's a distinction. And that's why probably it's not really that highlighted. And we look at the teachings of the paramitas. Again, there could be some correspondence between the present moment or acceptance, the idea of committed action, or self as context. So again, it's not 100% correspondence, but we can look at both similarities and differences between the two. I want to talk just a little bit about Dharma seals, because the 3 Dharma seals is one of the ways if we can see if something is aligned with Buddhist philosophies. So the idea of impermanence, emptiness, and nirvana, some may argue that ACT is supportive of this, but not exactly. And I think one of the thing about the discrepancy is the emptiness and the non-self. Because one time I was talking about ACT, and there was some disciples from the John Kabat-Zinn camp who came over and said, oh, it's interesting you talk about ACT, because ACT is very anti-Buddhist. And John Kabat-Zinn's group don't like it because they teach mindfulness. I said, how come you don't like it? They go, oh, they don't like the self as context part, right? Because they are afraid that the self as context reinforces the self too much. It should be more teaching, no self, right? And so this is a point that sometimes we look at the Western and Eastern psychology, the idea of the importance of having self as context could be a little bit different. But if we look at what Thich Nhat Hanh has said, interestingly, do you remember the cat before? One example we give in ACT is, A, B, and C. Right? A can be different from B. So that's the arising of distinction, right? The duality and the non-duality, right? As Thich Nhat Hanh also teaches, A is not A, B is not B, but A can be B. The interdependence of Buddhism is highlighted. In this way, it has correspondence with the RFT, right? Although in ACT, sometimes we don't exactly emphasize that part. In other words, if we look at the relational frame theory, it can help with this idea of interdependence, the no-self. Although in ACT, if we just do ACT alone, sometimes we miss that point if we emphasize the self as context too much. But one way to see it as self as context is like the beginning of detaching from self-labels as one step. And also, even though there's this argument, when I was making that presentation, at that time, the Dalai Lama's official interpreter was also there. And he was saying that actually this is okay with Buddha's teaching. And similar to what Thich Nhat Hanh also says, this idea of arguing you must teach no self and you must teach the self, but we can recognize that self and no self, they're also one inter the other, right? So rather than seeing those two as distinct concepts, one is right, one is wrong, and there may be a rigid interpretation that you have to teach no self, right? Sorry about the Korean. And acceptance in ACT comes from a place of, we teach something called creator hopelessness. So there are ACT techniques to talk about acceptance. I think it's not completely the same as how Buddhism would teach acceptance, which is more emphasis on deeper meaning of acceptance. So again, I think that maybe some understanding of Buddhist philosophy can also enrich ACT practitioners. Yeah, I realized I was trying to go fast at this because I know that there are only a couple minutes left. I also wanted to talk about, early in the slides, I even went over it, you see that the ACT processes, there were hand gestures. It's a set of hand gestures I developed to help teach the public ACT as a way that's kind of easy, because I was also working with some groups that they have very low education. Some of the refugees from Cambodia in Canada, they come, during the refugee, and they have no education. So all these words are very hard for them to understand, all right? And also Vietnamese too. So I have a set of hand signs I want to share with you that summarize the 6 different ACT processes. And I invite you to join me if you're willing. So if you put your hands together and you push hard, just push hard. This is like sometimes we struggle with our mind, the thoughts and the feelings. We want to push it away. But if we separate, that's diffusion. It's about introducing space. We're not one with the thought, we can observe the thoughts, and we open up in acceptance. It's like letting go of the struggle. It's pivoting in opening up. We come to the present moment, and we remind ourselves that we're not in the past, we're not in the future, we're in the center. In this one moment now, this is where we are. And if we do a fist and a cup, we remind ourselves we're the teacup, we're not what's inside. We're not defined by what happened yesterday, but we can be the teacup, the self as context, or the sky that holds the weather, the teacup that holds new tea from today, so that we're not stuck with yesterday's trauma or regrets. And we cup our hands. It's like if we're in the desert and we need water, and we put water, we don't want to miss a single drop. So this is about our lives. What do you really care about? You're sad about something, you're disappointed, but what do you really care about? Those are your values. And then we pinky swear, it's kind of like a committed action. How do you turn it into a kind of action? So this way, teaching the public a way of understanding the different kind of act processes and how we can move towards more effective action. So I have more to say, but I'm looking at the time. Do you want to hear more, or should we stop for questions? Just a little bit of case vignette. Okay, I'll just 1 or 2 minutes of case vignette. So I want to share just kind of one example of a case vignette. Yeah. So I was seeing a woman in Canada, an Asian woman in Canada, and she has depression, anxiety. She has been to many therapies and used medication, right, including CBT and many therapies. And one of her childhood trauma is that she was mistreated and abused by her mom, right? So through therapy, she recognized, oh, my mom is abusive. I have to be healthy. I have to put boundaries, right? And in fact, I should be angry at her. I do feel angry, and I should be angry, because she feels angry, and her therapist said, you're right, you should feel angry. But then she feels bad. She says, I'm Asian. I should not be angry. So I'm angry, but I should not be angry, right? So we discuss about this, about what she should do and should not do, and how do we deal with anger is so hard for her. And she said, and we did a meditation, and she said that for her, anger is like fire. It's very destructive. So when I think about my mom, I have a lot of fire. It's like I'm burning her, I'm hurting her. So when I really, because she want to push away the anger, if she allows her anger, then it's too destructive. It's bad. It burns everything. But when we meditate and talk about mindfulness, and kind of like what Thich Nhat Hanh had said, can we transform unwholesome to the wholesome? Is there a transformation of the anger? When we talk about this idea, her meditation, then she goes, oh, I'm no longer a helpless child. I have the fire around me, but the fire is a protection. It's actually not hurtful. So it's okay to be angry, because anger can serve a different purpose. It doesn't have to destroy, it can protect and keep warm, right? Because she was a helpless child, right, in a way. So in her mind, it's transformed in a way, the anger into this. And I said, what about mom? How about mom? It's not burning mom. And so through some guided work in ACT, she was able to say that actually she can include mom too. She can also see mom suffering, and she can have compassion for mom. So the fire protects her and protect mom at the same time, right? So, ACT, we don't always, so ACT works in many different ways. It's about principles. So we don't always use guided imagery, but in this example, through some guided imagery work, I think it illustrates the principles of mindfulness and transformation of unwholesome to wholesome. And there's an idea of acceptance, that there is anger, and yet there's the interconnectedness with the mom. That wasn't possible before in strictly Western psychological therapy, because that's about right and wrong. Your mom is wrong. But this is about our compassion and interconnectedness. So there's something about the compassion, interconnectedness that was helpful. We often use metaphors and many other activities so that people are able to liberate themselves a little bit from their own thoughts. And this is just one example that might spur on more discussion. So maybe I'll stop here and for questions. Thank you.
펑 교수님의 발표 잘 들었습니다.
Thank you, Professor Fang, for your
수용
presentation.
불교가 어떻게 융합될 수 있는지.
We have seen the connections between the Buddhism and ACT. Because you came from so far away, I gave you a little bit more time. Thank you so much for such an interesting example with pictures at the end. Before the discussant's discussion, we will introduce her. This is Choi Myung-hee, member of the Hammaum Science Institute. She used to be the middle school teacher, but currently a lecturer at Gyeongbuk National University. She has done many counseling activities and teacher programs. Thank you.
네, 반갑습니다. 펑
Nice to meet you,
교수님
everyone.
발표 너무 잘 들었습니다.
Thank you for your presentation, Professor Fang. ACT and Buddhism in Korea is seen as two things that are closely related to each other. But thank you for a new viewpoint from the Western societies. Also, thank you for connecting those Buddhism teachings with some Master Thich Nhat Hanh, and it helped me tremendously to understand the philosophy. And at the end, the vignette that you shared was very interesting. It was fascinating to see the details of the transformation. I will start with the question.
쪽을 보시면 네, 토론문이 있는데요. 이 중에서 제가 드리고 싶은 핵심적인 질문만
I
골라서
will
말씀을
go right
드리겠습니다.
into the questions.
과 이 불교를 연결하는 부분에서 저희는 한국 불교의
In connecting
대표적이신
some Master Thich Nhat Hanh's teachings and Buddhism and ACT, I thought of its connection with Sun Master Tang's teachings.
그러나 그 고통 역시 오히려
The teaching that
고통에서 벗어나게 하는 그런
the suffering is actually guiding us in our lives to become better. And some Master Tang also proposed some methods to overcome your suffering. So my question is related to things like that.
액트와 불교적 철학의 연결성에서 받아들임의 진정한 실천을
The presenter, you highlighted the importance of acceptance in both ACT and Buddhism. May I ask your opinion on possibility of letting go being developed into a structured therapeutic concept?
그 발표자님의 관점을 한번 여쭈어보고 싶고요.
I will also ask you the second question altogether. The ACT was developed as a psychotherapy theory, but I believe it can be disseminated as a principle applicable to everyone's life in terms of attitude and orientation towards life, similar to the presenter's perspective. I would like to ask your views on this perspective from a psychoeducational standpoint.
Yeah, thank you very much for the questions. I will begin with answering the second question first, which is from a psychoeducational standpoint, is it helpful for everyone? I need to pause, right, for interpret. So I think one of the unique things about ACT is that it's seen as a non-pathological, non-pathologizing therapy. In other words, suffering is not seen as pathology, but as part of the human condition. So it can be used for clinical situations like depression, anxiety, but it can also be used in general population to increase well-being. And in ACT therapy, it's even more common for therapists to talk about how ACT has helped them personally. A common ACT metaphor is that a therapist and a client, they are all climbing mountains. It's just that if you're on a different mountain, you can help guide the other person, but we have our own mountains to climb. I'm listening for the translation to finish. and so that's why it is possible to act in an educational way for everyone. And I was just also thinking about the case. This is another point. I know that as a cultural psychiatrist, one of the cultural bound syndromes that's known for Koreans, and I don't know if it's true, but it's called hwabyong. That some women might suffer from hwabyong. So perhaps from a cultural perspective, you can see that this is not about necessarily only clinical condition, but educational condition. And to relate that to the idea of teaching acceptance, from an ACT perspective, acceptance is defined in a certain way. In ACT, you see the left-hand side, the acceptance, it's more about accepting that we have thoughts and feelings. In a diffused, mindful way. So it's more about internal experiences that we're accepting. But on the right-hand side, it's about action. So acceptance is not about accepting we cannot change external conditions. In fact, by accepting we have thoughts and feelings and suffering, if we accept that, it can lead to more workable actions that's value guided. And so I think that's how ACT structures acceptance. As a willingness to experience thoughts and feelings. And there are various ACT metaphors and exercises that help cultivate this acceptance. And so, through this acceptance, but also motivating action, and this action can also even include acting on the external environment. Both individually, but also societally. So we have also used ACT to help people to be empowered. Empowered to fight social issues. Like discrimination. So, and other kinds of social injustices. And this would be in alignment with engaged Buddhism that Thich Nhat Hanh encouraged. So if we think the world has a lot of pollution, it's not accepting it, it's actually, we can do committed action. Yeah. So does this answer some of the questions?
네, 감사합니다. 청중 시간 관계상 많이는 못 받겠지만 청중
We don't have not much time for questions, but we'll welcome some questions from the audiences.
네, 안녕하십니까. 대행선 연구원의 오진영입니다.
I'm Daengsan Studies Center, Jinyoung Oh. I just have a small question. You have connected Buddhist values to clinical psychology. There is, in the sixth root unwholesome mental factors you talked about, in Buddhism they use raja, but in the second, instead of pradi, anger, they use something different.
두 가지 용어가 다른 의미로 쓰이기도 합니다. 그리고 아비드야는 저희가 이제 치보다 변명으로 많이 써요.
And avidya, ignorance or delusion. I wonder why you have used the Sanskrit words to describe these.
I was we were looking at some of the potential overlap between what's described as unwholesome mental factors and ACT processes. So we were looking at some of the Sanskrit word. And the Chinese word. At the same time, we know that you can see the slash, anger slash aversion. At the time, I found there were different schools of Buddhism, and interpret some of this a little bit different. So I wanted to include both because there's the origin, but then the different schools of Buddhism emphasize slightly different. And I also want to show how some of it correspond in some way to ACT, but there's never expectation that they should correspond. Since the 6 processes were not developed from the teachings, but we were able to see that there are potential similarities. Yeah, so this is what I feel for the others too, even acceptance or mindfulness. And as I said, culturally, one can understand why pride would not be a significant thing. From a Western psychological perspective.
네, 좋은 강연 감사합니다.
Thank you for the great presentation.
네, 한마음과학원 김민선입니다. 전 초등교사로 오랫동안 근무했습니다.
I've been working as an elementary school teacher for a long time.
ACT를 실천하고 있었던 것 같습니다. 대행선사의 그 주인공 관법이
I think there are a lot of connections with some Master Daeheng's teachings with ACT.
실제로
I see children with anger or problems or lonely children. I thought it was very well connected to some Master Daeheng's teachings, and if there's opportunity, I hope you could have some interest in some Master Daeheng's teachings also, in addition to some Master Thich Nhat Hanh.
감사합니다.
질문이라기보다 코멘트에 가깝긴 합니다.
Okay, this was closer to comment rather than question. Is there any questions? Maybe one more person for the last time.
네, 안녕하세요. 펑 교수님. 그 수용 전념 치료 새로운 방향에서 아주
Professor Fong, hello.
연구를 굉장히
Thank you for giving us a new viewpoint for ACT. I am very impressed with your experience and research. Thank you for the impressive presentation. In the middle, you talked about the difference between fusion and Buddhism.
서양에서는 긍정적 감정,
In the Western society,
동양에서는 부정적, 굉장히
you said in the Western society it's something positive, and in the Eastern society, pride is something negative, and it may involve some jealousy from others. But for you, Professor Fong,
내담자 갔을 때 어떻게 치료하실 것인지
if you have any patients who come to talk to you about pride, how would you go about it? I'm suddenly curious.
교수님 혹시 대답하기 전에
Before
마지막
you answer, Professor Fang, we have maybe ask one more question. You could answer all together.
강연 너무 재밌게 들었고요.
Your lecture was very impressive. Thank you so much. As you live your life, I often tend to get attached to future. And I want to come back to my reality. Is there any advice for you? And I would like to ask you about the concept of diffusion again, because I was a little bit confused. Thank you.
Okay, yeah, thank you for the questions. I think to answer both questions properly, we need to have another 1 hour workshop. I will try to answer in brief. First, about pride, there are cultural studies that show differences. Even young children, if you say a story to young children that, oh, you have this classmate who's very proud, you ask Asian students, they would say, oh, that person is too proud. But if you ask US students, they will say, oh, it's good. This person is so confident. Look at the current president. So there are definitely differences in cultural. So when we treat people, it depends on where their culture is. They will come with different assumptions. But maybe even more important will be looking at context. Because in some situations, having sense of pride can be transformed to something helpful. But in other circumstances, it can actually be harmful for themselves and people around them. So in ACT, we try not to teach this is right, this is wrong. To guide the person to think about, in this situation, how do we function better? So that's why it depends. And even intergenerationally, there's a lot of pressure about proud. I think for Asians, it's not good to be proud about yourself. But parents feel proud of their children. And sometimes that's not helpful for the children. That can put a lot of pressure. So that's why it depends on the situation. And I would say how it also can cause issues in relationships. Yeah, so it's a complex thing. So that's why fusion and diffusion. Diffusion is about letting go of some of your thoughts. So there are three major categories of thoughts, especially in ACT we target about diffusion. One is judgment, right, wrong, good, bad. The second is about rules. Sometimes we just stick to the rule. We forget that the rules are made from values. So sometimes we stick to the rule rather than the value. Like the rule, I should not speak too long over my time. And then finally, there's reasons. If you ask a person, "Oh, how come you did not do this?" "Oh, you wanted to exercise. How come you didn't do it?" You wanted to, yeah. "Oh, how come you want to sleep early, but you didn't do it?" "How come you want to apply for a job, but you think it's too hard and you didn't do it?" They will give you a lot of reasons. And the reasons may be about the past. "Oh, I failed before." Or about the future. "Oh, I'm not going to be successful. I'm going to fail." So these reasons and stories is also what we can diffuse and let go of. Including labels about ourselves. So by letting go of judgments, letting go of rules, and letting go of stories and reasons, we can come back more to the present and think about what we care about and how to take actions that's values driven. I hope that clarifies diffusion a little bit. But I think ACT, these principles, is simple to kind of understand, but of course it's harder to practice. So it requires, either therapy or maybe if you invite me to do a workshop. That is longer than 1 hour. Because it's about really experiencing these processes. And how we can use it in our lives. And I have, thanks to some of my dear friends at the back, like Ji Hei at the back, and Emma at the back. We have been doing some work, for example, to help caregivers in Korea. You can maybe talk to also her about, connect with her. And Ji Hei is now a great teacher in ACT.
감사합니다. 조금씩 더 시간이 많다면 더 많은 이야기를 듣고 싶지만 저도
Thank you so
잠시
much. We would like to hear from you more, but we will let go of this thought. We have taken some time because of interpretation, but we had a great time looking at psychoeducational standpoints and other potentials that it could be used, that act could be used, and other thoughts involving Sun Master Deng's teachings. All the discussions were very great. Thank you so much, everyone. Thank you, Myung-hee Che, for her discussion. We will have a 10-minute break. Thank you.